Every female should know what their risk factors are and know that there are things that can be done to prevent breast cancer. Men too. There's 1,400 breast cancers in men every year. So men, if you feel a lump in your pectoral muscles, be sure that you get that looked into also. Now, can breast cancer be prevented? Well, there may be some things that we can do to prevent breast cancer. Number one, we do know that fatty foods, the more you eat, the more your chances are of getting breast cancer. So you need to eat good foods. Exercise is very important. Studies have shown that if you exercise on a regular basis, you have less chance of getting breast cancer. Now, you can't prevent it in everybody, but those are times where it can be prevented. There are some studies on genetics that we can take that can tell you if you have a high propensity. Right now, we worry about if you've got abnormal genetics, what do you really want to do about it and how scared would that make you? So let's just talk about exercise and eating properly. Who's at risk? Well, and that's very, very interesting. Number one, you're at risk if you have had cancer in one breast, and now the chances are you may get cancer in the other breast. So that's one risk factor. Number one, if your mother or sister had breast cancer at an early age, then your chances of getting breast cancer at an early age are also very important. So that person starts getting mammograms before age 40. If there's no risk factors, you start getting your mammogram at age 40 or when you and your doctor make a decision to start getting your mammograms. Women that have an early onset of their menstrual periods have an increased incidence of getting breast cancer. And the other side of that is when women go through menopause at a later age, most common age is age 49, but if you get it at a later age, menopause, then you also have a greater increased chance of having cancer. So when you see your OB/GYN doctor and get your breast exam, and remember, you should examine your breast once a month, right after your periods. That's where it's easier to feel your breast. And your physician should examine your breast once a year. When you're talking to your physician about breast cancer and risk, be sure that you get out a plan for mammography and be sure that you get that done.